Hello, my dear doctors. Dr.MedExedu Indian Medical Society is going to start few MCQ based session based on the community medicine. Hope you will get a lot of advantage from this. Public health is a crucial aspect of a nation's well-being, and the role of government is ensuring the health and welfare of its citizen is paramount. In India, the government plays a vital role in various aspects of public health to safeguard the population from diseases and promote overall well-being. So, community medicine is very important, and the role of government in public health in India is very important for public. Okay, so this subject is very important for FMGE exam. At least 30 to 35, you can say, questions come to either NEET-PG or FMGE. This subject weightage is very high. Okay, so come to the question number 1. Okay, question number 1. Okay, 45-year-old man presents with progressive shortness of breath and history of working in a mining for 22 years. Chest X-ray is given here. Okay, so is the multiple small nodular opacities predominantly in the upper lobes. Hilar lymph nodes have an egg cell calcification. Hilar lymph node have here the egg cell calcification. Okay, calcification pattern. What is the most likely cause? Okay, so here the person is working since long time, 22 years, and shortness of breath, and working in a mining area. Egg cell calcification is the key point here. Okay, I have shown in the X-ray. So the answer is A, silicosis. Come to the question second. Okay, come to the question second. Which of the following is false regarding the crude death rate? Okay, false regarding the crude death rate. Okay, so first of all, I will tell you one important table. I will explain you, then we can come to this question. Okay, yes, here. Okay, given a statement and the true false explanation. Simplest measure of mortality, CDR. Okay, CDR is the simplest overall measure of mortality in the population, calculated as total death per median population. This is true or false? Okay, so this is true. Okay, this is true. Denominator is the median population. Denominator is the median population in the crude death rate. This is also true. Okay, the standard practice uses the median population as the denominator to reflect the average population during the period. Okay, C. Okay, C. Used to calculate the growth rate. Yes, it's true. Used to calculate growth rate. CDR, when subtracted from the crude birth rate, gives the natural population of the growth. Okay, this is true. It is age or sex specific. No, this is false. It's not age or sex specific. Okay, crude death rate is general rate for the entire population. It is not adjusted or specific for age and sex specific rates. Okay, so this is not specific. Okay, so this is our answer in the question. Okay, come to the question. Which of the following is false? Okay, which of the following is false? A, simplest measure of mortality. Yes, true. Denominator is the median population. Yes. Use calculate growth rate. Okay. D option, it is age and sex specific, is a false. Okay. Come to the another question. Question number 3. Come to the question number 3. Again, you can we can solve this table. Okay. This table This table indicate given a statement and explanation in true and false. Okay. So proportional mortality rate PMR is proportions. Okay. Proportional mortality rate expresses the percentage of death due to a specific cause out of the total death in a population. It will indicate the burden of a disease. The first one is true. Okay. Second one is true. PMR shows the relative contribution of the disease to overall mortality burden among the death. The denominator is the total number of death. Denominator is the total number of death. PMR uses total death as denominator with the numerator as death from the specific causes. Okay, so this is also true. This is also true. Okay, this is also true. D, it will indicate the severity of the disease. No, it's not indicate the severity of the disease. PMR measures proportional distribution among the death, not disease severity, case fatality, incidence, or a population risk. So come to the question. Okay, come to the question. Which of the following is false regarding the proportional mortality rate? It will indicate the severity of the disease. This is the answer. Okay. Okay, this is very important, very easy question. Median population is taken on what date? July 1. Okay, July 1. July 1. As median population is taken on July 1, July 1st, note that the median month is different from the census month. These differences are taken into account when calculating parameters for which the median population is used. So here is there some important point, some important point is here, some important point, very important to know in the median. Yes, here, yeah. What is crude birth rate? Okay, crude birth rate. Okay, crude birth rate. Crude birth rate is birth in country, divided by mid-year population hundred 1000. Okay, crude death rate. Okay, crude death rate. What is it? Death in the country. Death in country. Death in country divided by mid-year population. Mid-year population into 1000. Okay. So what is demographic gap? Demographic gap. Demographic gap is crude birth rate minus crude death rate. Okay? Crude birth rate minus crude death rate. Demographic gap is crude birth rate minus crude death rate. Okay. Come to this explanation. 19 September, not a standard mid-year reference date. This is not true. This is false. Okay. 21st June is a little close, but it's not true. False. Okay. 1st April, typically fiscal year, financial year starts, not mid-year population. This is also not true. False. Okay. 1st July, this is true. Okay, this is true. Mid-year population is tentatively taken on the 1st of July. per UN and the international statistical conventions. Okay, so this is true about the question. Come to the another question. Question number 5. Come to the question number 5. Very important question. Okay, this question is a village child reported to your clinic with runny nose, fever since 3 days. The rash started on the face. A rash covered the trunk of the body. After some time, you can find the rash in the image. What's the most likely diagnosis? What's the most likely diagnosis? See the rash. Okay, these are the clinic runny nose, fever, and rash started on the face. First of all, rash started on the. This is the rash. Okay, see the rash. This patient have fever, key point, runny nose, okay, and fever for 3 days, okay, and rash started on face, okay. Also, it's covered the trunk, okay. So the symptoms seems like measles, okay, typically appears 7 to 14 days after exposure of the virus and typically include high fever, cough, runny nose, and also sometimes watery eye, okay, sometimes watery eyes, okay. So option A is correct. Come to the next question. 6. A metro city couple brought their baby boy to the family physician. They were worried because their boy likes to eat food from the multinational companies. What will we call this shift from the consumption of traditional natural foods to Western fast foods? Okay, so come to the this table first of all, then you can understand the question. Okay, this table explains. This is true or false. This explains the shift from the traditional natural foods to processed Western fast foods, often linked to urbanization and globalization in the developing countries like India. Okay, this is true. This is true. Okay, this is true. This is food transition. This is food transition. Okay, this is food transition. This is called food transition. Acculturation refers to the broader cultural assimilation, not especially food consumption changes. This is false. Okay. Social pathology relates to the social disorder, deviance unrelated to the dietary shift. This is false. Demographic change involves population structure shift, age, migration, and this is also false. Okay. So, food acculturation refers to broader culture. Okay. Acculturation refers to broader culture, but this boy is changing his food habit. I can say is food transition. Okay, not acculturation, because acculturation covers big area. Okay, with cultural. Acculturation refers to broader cultural assimilation, not specifically food consumption changes. Okay, come to the question 7. Okay, come to the question 7. A child from the remote village presented with white patches on the central and anterior incisor. Later, it turned brown. Okay, which of the following components is responsible for it? Okay, so of course the fluorine is responsible for it. See, anterior canine and central incisor. Okay, anterior incisor. So this is good. Okay, but here is a fluorine. Okay, the above scenario describes the dental fluorosis. What is this? This is called dental fluorosis. Dental fluorosis. The fluorosis occurs when drinking water contains excess amount of fluorine. What? Excess amount of fluorine. Drinking water contains excess amount of fluorine. It is based on the upper incisor and permanent teeth. It occurs when drinking water contains excess amount of fluorine at range greater than 3 to 5 milligram per liter. Okay. If fluorine is like this, then dental fluorosis will happen. Okay. Come to the next question. Okay. Come to the next one. Shelf life of copper T. Shelf life of copper T 380A. That is, this is copper T 380A. 380A. That is 10 year. Okay. 10 year. 10 year. Come to the this point. Yes. Note point, a catchy point. IUD type, shelf life, shape, and brief information. Okay. Copper T 380A. What is the shelf life? 10 year. This is our question. Okay. The standard copper T IUD with 380 meter square copper T. Okay. This is the answer. Maybe next time this question can come. CUT 375. What is the shelf life? 3 to 5 years. Okay. 3 to 5 years. T-shaped. This is also T-shaped. Okay. T-shaped. Lower copper load than 380A. Lower copper. 375 lower copper load. Shape is very good. Inverted U and pseudo T. Inverted U and pseudo T. You can see here. Okay. This is copper T 375. Copper 375. Okay. 3 to 5 year. 3 to 5 year shelf life. Okay. And this is shape is inverted U or pseudo T. Okay. So this is one word. Okay. LNGIUS shelf life 5 to 8 years. Shelf life 5 to 8 years. 5 to 8 years. 5 to 8 years. Shape T-shaped. Okay. T-shaped. T-shaped. For the start is 1 year. Okay. That is also T-shaped. Okay. And Nova T is 5 year. That is also T-shaped. Copper IUD with silver core. Question number 9. Come to the question number 9. S in safe strategy of trachoma stand for. Okay. That is, S is surgery. A is antibiotic. That is hygiene. E is environmental sanitization. Environmental sanitization. Okay. Environmental sanitization. Eligible couple register is maintained at which level? Eligible couple register is maintained at sub-center level. Eligible couple register maintained at the sub-center by female health worker. Married couples in the reproductive age groups are eligible couples. Okay. Come to the question number 11. Okay. Question number 11. A person living with his wife who is pregnant and also has a child less than 3 years old. His brother and his wife came for the winter vacation for 1 month and stayed together. Now you went to survey their family. Which family will you note? Nuclear family, extended family, joint family, and third generation family. Okay. Come to here. Parent definition, family type and definition. Parent plus dependent children only. No other relatives. No other relatives. Okay. Which type of family? So this is a nuclear family. This is nuclear family. Okay. Nuclear family. Next, nuclear core. That is nuclear family in additional relatives, temporary or permanent. This is called extended. Extended family. Okay. Temporary or permanent, someone is coming to stay with family. Multiple brothers, family sharing residence, resources, usual, permanent, same, cooking. Okay, this is joint family. This is joint family. Okay. 3 generations living together, grandparents, parents, and children. This is called third generation. This is called third generation. This is called third generation. Okay. Okay, that question is enough. We'll have some important anatomical landmarks. This is a key point. Every day we will do little bit about the anatomy so that your anatomy will be strong. See here. Okay. This is tis. This is tis. This is infraspinatus. Infraspinatus. Tis. Okay. And this is teres minor. Okay. Teres minor. This is infraspinatus, teres minor. Okay, serratus anterior. This is serratus anterior. This is levator scapulae. Rhomboid minor. This is rhomboid major. Okay, here triceps brachii. Here is a triceps brachii. Biceps will be in the front. Triceps here in the back. Okay. Come to the types of angina. Okay, types of angina. Types of angina. This is, see how it is, good, very good. Okay, so normal coronary artery. See, this is partial unstable angina, atherosclerosis with blood clots, and this is stable angina. Okay, atherosclerosis both in the both side. See, okay, this is variant. This is variant. This is variant. Please try to know. See, circle of Willis. This is aortic arch. See, aortic vertebral artery. Here, basilar artery. See, cerebellum. This is cerebellum. Okay. Subclavian artery is here. Brachiocephalic. Subclavian. Okay. Subclavian, this one. An external carotid. Come to here. Circle of Willis. Circle of Willis. See here. There is vertebral artery, internal carotid artery, basilar artery. This is basilar artery, posterior cerebral artery, posterior communicating artery, middle cerebral artery. This is middle cerebral artery and then anterior cerebral artery. Okay. So this is all about today. Thank you very much. Thank you very much, my dear friends. Thanks a lot. Thanks a lot. If you people like it, then you share with your friends. I hope you will get a lot of advantage from my class. Next session, I will make it, I will prepare it, and I will share with you on the YouTube channel. Please, it's my request, kind request to you people, share with your friends, those students who are again and again suffering or didn't pass the exam because of 4 marks, 5 marks, 6 marks. So I hope they will get some advantage, and I'm sure they will pass this exam this time. Okay. So it's my blessings, and also it's my kind support that I am making. I'm doing very hard work to prepare this lecture for you. You try your best to get advantage from this. Okay. Thank you very much. Have a nice time. Bye bye.